Hello, everyone, and welcome to this edition of CRATV, where we talk about politics, policy, and politicians, all from a conservative perspective, right here in the great state of California. So please take a moment, like, and share the program so that your friends can know where the conversation is taking place. Also, if you haven't already done so, please remember to subscribe to our YouTube channel, follow us on Facebook, and follow us on Instagram. And in the case of YouTube and Instagram, make sure you hit the notification button. That way, you'll get the notifications as soon as we go live. Also, make sure you do that for Facebook as well. Also, I want to remind you, we are a membership organization. The California Republican Assembly is the largest, oldest, and most successful grassroots conservative organization in the state of California. If you want to make a change, this is the place to do it. All you have to do is follow the join link in the description of this video, and you can join and become a member either at large or one of our many chapters throughout the great state of California. All you got to do is just check it out. Once again, that's cra.org/join. It's right there. The link's right there in the description of our video. And by the way, for those of you who are members, we have a convention coming up. It's going to be taking place. It's going to be a one-day convention. It's going to be on August 29th. No, it's going to be at the Lamplighter Inn, which is where it was scheduled to be at before. This is largely going to be a business meeting, so not going to have as many speakers and whatnot as we normally do at these events, but it is going to be a great event. You are going to want to be there and be a part and connect with like-minded conservatives, members of the California Republican Assembly from up and down the state. So make sure, all you got to do, once again, if you follow the link in the description of this video, you can go ahead and you can register to join or be a part of the convention. So make sure you guys do that. Remember, Saturday, August 29th, is going to be taking place in Visalia, California. All right, let's get on to today's topic. Now, some of you know, and probably most of you don't know, I sit on a school board here in Sacramento, California. I sit on a small school board in North Sacramento. We're a relatively small district. But one of the things we've always prided ourselves on is that when we make decisions, it's usually based on data and information. I mean, we have a pretty diverse board. We've got folks on the right, and we've got folks on the left. Happen to be a majority conservative board, but but we largely vote 99.9% of the time the same way. And that's because we all make sure to focus on our number one job is to make sure that we're making decisions that are good for our students. And we're not looking at partisan political information. We're specifically looking at data. What is the data telling us, and what are the facts telling us? And then we sit, we talk, we debate, we discuss, and then we come up with a plan that works. Now, that was until COVID-19. Now, for the most part, we still make decisions like that. But when it came to COVID-19, when we first shut down our schools, the interesting thing was that it was largely because, well, everyone else is doing it. We didn't have a whole lot of data or information on COVID-19. I know that at the time, I remember at the time asking, what epidemiologists or virologists or immunologists, are any ologists at all recommending that we just blanket close our schools? The CDC wasn't recommending that you just blanket close schools. In fact, when most of the school districts in Sacramento County or throughout the state decided that they were going to close their schools for 5 to 8 weeks, it actually went against CDC guidelines and information because they basically said that short-term closures, less than 8 weeks, weren't going to do anything to slow down the spread of COVID. They absolutely positively wasn't going to do it. So it made absolutely no sense at the time. But guess what? Everyone was doing it. All the politicians were saying we should do it. And so that's what school districts wound up doing. Now, fast forward 4 months later. Now, keep in mind that now we've got 4 months worth of data behind us. Supposedly, we've been doing contact tracing. Supposedly, we know mortality rates. We know who's getting it. Supposedly, we have information and data that will help inform us to make a quality decision. Well, guess what? No, we don't. Or at least the data, I'll just put it to you this way. Here's what's happened, and this is what I want to talk to you about today, is the information and the data that's being given to us or being provided to us by those in leadership is not consistent with the advice that they are giving us, or at least the data that is available is not consistent with the advice that we are being given. Now, I'll be the first to tell you, I am not in favor of opening up our schools and putting an end to or reducing the amount of distance learning that we're doing if it's going to put our students and our staff at risk. It's, my job as a trustee, as a school board member, is to make decisions based on the data, make decisions that are in the best interest of the students. But the problem is that when I asked for this data, when we asked as a district for this data, the county in which we reside, the state in which we reside, well, the people offering this information or these recommendations did not provide the data that supported their recommendations. In fact, the only data that they could provide that supported their recommendation was the increased number of people who were testing positive for COVID. Other than that, which, by the way, we always knew more people were going to test positive for COVID. I mean, the idea behind this whole thing was never, okay, we're going to keep people from getting it. The whole idea was we don't want everybody to get it at the same time because it will overtax our healthcare system. And thus, it'll increase the number of people who will potentially wind up dying from this virus, right? That was the goal. So now let's take a look at the data that is in fact available and see exactly what that data that is available tells us about what we should be doing in relation to COVID-19. All right, so let's start with number of positive cases. So in the state of California, we've seen a dramatic increase in the number of positive cases. In fact, we're up to 466,550. I remember it seemed like not too long ago, that was how many cases there were in the entire state of California. Now, mind you, that also puts us at number one in these United States for number of positive tests. Right behind us is the state of New York, who, as you all know, was probably the early epicenter for COVID-19, and still by far leads the nation in the number of deaths related to COVID-19. And we're talking, but they got us beat by at least 4 times, right? So those are the numbers there, and and the interesting thing about it is, and then once again, we can break these numbers down even a little bit more. Once again, while the numbers have increased dramatically in terms of the number of cases, what hasn't increased as significantly is the number of deaths. Let's take a look at that. So we see now we're at 8,518. Now, the interesting thing about that particular number is we're still seeing the numbers overall, and I want you to look at this graph here. The overall number of deaths that are being reported on a daily or weekly basis, the weekly averages has not significantly increased. In other words, it hasn't increased as dramatically as the number of as it has for the number of reported new cases. Take a quick look at it. See the difference between the two. That shows you that there's not a significant difference, once again, between the two. I mean, there is a significant, let me clarify. That shows you that there is a significant difference between the two, meaning that even though more people are testing positive, it doesn't mean that more people are dying. Now, why is part of that? Part of that is, well, if you look at let's go back here again, and you look at the number of people who have contracted it, there's a significant increase, once again, in those between the ages of 18 to 49. That's 60%. That wasn't the case earlier. In other words, what's happening is more and more people who are getting it are people who are between the ages of 18 and 60. Well, why is that significant? Let's go back to the numbers. So if you are between the ages of 50 and 64, right? 17% of those who've died are actually between the ages of 50 and 64. 76% are over the age of 65. 76% over the age of 65. And unfortunately, right here, I don't have the data for the number of individuals who had it under the age of 65 who also had pre-existing conditions. But I guarantee you, if it sits with the national average, it's somewhere about an additional 15%. All right? So that means 15% of those, 15% under the age of 65. So, but here's something else I really want you to get a hold of. Now, this has to deal with our schools. From age 0 to 17, there have been no deaths, or 0% of people who have contracted COVID-19 between the ages of 0 and 19. We're talking infants. We're talking school age. All right, these are school age kids. None of them, absolutely positively, none of them are dying. It's just not something that is in fact happening. But another thing that we need to look at is we need to take a look at hospitalizations. Once again, not just people who have to check into the hospital, but people who wind up seriously ill, right? Let's take a look at those numbers. So in the state of California, it's been noted that we have about 7,881 ICU beds in the entire state of California. And based on the best available data, that's based on the best available data. Now, 38% of those are currently occupied with non-COVID patients. It's about 2,994, which basically leaves us about 4,887 beds to address those with COVID. So how many people have COVID? Well, that number is 2,284 people are hospitalized in ICU with COVID, right? These are individuals who have COVID and are in the hospital. That basically means that about 47% of available beds are still beds of vacant bed. There's still about 47% of vacant beds that are available for patients with COVID. That's 33% of all ICU beds throughout the state of California are basically available for patients. Now, here's why that's important. Because most of what the governor is doing right now, most of the restrictions that he's placing, the things that he's using his emergency powers for, is because in the very beginning, it was believed that things were going to be a whole lot worse. And that our medical system was not going to be in a place where it was going to be able to handle the number of cases. Well, guess what we're finding? We're finding that here in the state of California, we are more than capable, especially 4 months later. 4 months later, we know that we have enough ICU beds. We've determined and we've identified some ways in which we can help people deal with and cope with the symptoms of COVID, which are the things that have oftentimes caused people to die. We've come up with treatments and things like that are helping people recover faster and easier from the symptoms of COVID. Now, let's get back to, once again, making decisions based on data and science. So I've just shared information with you that tells you a couple of different things. Number one, children aren't getting sick. They're not the ones that are contracting COVID-19. And those that are not transmitting it. In fact, there was a recent study that was done that showed that very same thing. There was a study that was actually done in a European country, in Sweden, where they found that even though they left the schools open, they found that there was not significant transmission of COVID-19 amongst school-age children. There's also another study that once again was done right here in the United States that demonstrated that there was not significant transmission of COVID by or amongst school-age children. In fact, I can only speak anecdotally, one of the local school districts in the area, actually their county was doing COVID-19. They were doing contact tracing. And even though their schools were closed, like in many communities, they found that there was still daycare providers. Like in the city of Sacramento, the YMCA shut down all services so that they could provide daycare services to kids that would normally be in school. Well, the contact tracing that was done in this particular county, in this particular area, demonstrated the exact same thing, that children are not spreading COVID-19. So here we have data that is basically telling you that, kids should probably be in school. because they're not the ones that are spreading it, because they're not the ones that are contracting it, because when they do contract it, they're not the ones that are getting sick. But instead, what we're doing is we're basing decisions. We have a governor that is making decisions based on what? Explain this to me. Explain to me, how is it that people can go into grocery stores, into places like Walmart, on a regular basis, on a daily basis, multiple times per day? You have people working long hours there, and yet I don't see any data showing that there's a significant number of increase in cases amongst those who work in any of those industries. Why is that? Why is it that we feel like we can trust someone working at Walmart to take care of themselves and protect themselves from contracting COVID more than we can trust our college-educated public school teachers from contracting COVID? I don't understand that. I don't understand how we can have a governor who passed legislation that says, well, no, you can't go to church. And if you do go in areas where you do go to church, it has to be at 25% capacity. And by the way, it can't have more than 100 people. Ignoring the fact that there are many, many, many churches that actually can hold way more than 100 people. Some churches have like 3,000 to 5,000 seat sanctuaries. So now you're telling me they can only have 100 people? You're telling me that these are churches that can easily hold 1,000 people or 800 to 900 people and still safely socially distance. But that wasn't enough. On top of it, he says you're not allowed to sing or chant. Now, please, Mr. Newsom, tell me what bit of data, what science is that based on? What are you basing this on? I mean, okay, here's the thing. You're the one that keeps telling us to wear a mask. If I am wearing a mask and I am singing at church and I am 10 feet away from anybody, how is it exactly if I'm singing or chanting, I can potentially pass COVID on to somebody? I mean, if the masks work, if social distancing works, how exactly does that work? See, I want you guys to understand that, and I want you to get a hold of this, and this is where I keep asking folks, show me the data. Every math class I've ever been to, every math class I've ever taken, what's the number one thing your teacher told you when you took math? Show your work. Governor Gavin Newsom, public health officials of the state of California, show your work. Right now, the CDC is laid out guidelines for when schools or what schools should do when they reopen. Now, keep in mind, they never recommended mass shutdowns. Unless you were in the middle of a hotspot or there was an outbreak at a particular campus, they never recommended wholesale closing of schools. In fact, I don't know that any epidemiologist has recommended, any immunologist has recommended, any virologist has recommended it, any ologist at all. But yet still, that's what we're doing. See, folks, here's the thing. We're now operating in a place where folks are promoting fear. And the media is doing it because, well, the media, they need clicks. They need you to tune in. They want you to be scared. The politicians, they kind of have double motive. Number one, they don't want to admit that they made a mistake by shutting down the entire state. They don't want to admit that they made a mistake, that rather than focusing on essential versus non-essential, they should have been focusing on safe versus not safe. They should have been focused on how do we protect those who are the most vulnerable among us without shutting down the entire economy. They don't want to admit that they were wrong. And they definitely don't want to admit that the data, that the science that they've touted this entire time doesn't support the decisions that they have made. And they don't want you to know it. And most importantly, in many of these cases, Well, they don't want the economy to come back. You know why? Because they know that there is a presidential election. And they know that if the economy is doing well, they know that it's going to cause problems for them in their desire to elect Joe Biden as president of the United States. Remember this. Go back to just a few weeks ago when they were talking about when the economy opened back up. You saw drastic increase. You saw the economy grow like it had never grown before. You saw unemployment actually started to take a reverse and actually started to go down. Consumer confidence went way up. We started to see it was a fast track to the restoration of the economy as people started to come out of their hiding places. And well, folks in places like California and New York and many, many, many more of these liberal states, they decided, we can't have that. Because if the economy bounces back, Trump gets elected. If Trump gets elected, well, then they don't get to reshape America in their Marxist socialist vision that they're now pushing through the Black Lives Matter movement. Anyway, I just wanted you guys to understand. I just wanted to go over some of those numbers because, like I said, as a person who's also a policymaker, I know how important it is. This isn't about politics. This is about protecting people's lives, right? But part of protecting people's lives is making sure that we're protecting their future. And these are in many cases, when I talk as a school board member, right now our children are losing invaluable education time. Their futures are being put in jeopardy. And the students we serve are some of the most at-risk students in our society. They can ill afford to have their futures sacrificed on the altar of political expediency. We need to be making decisions that are about their entire life, not just their life now, but their entire life and their future. And if we're going to do that, it's got to be based on the science. It's got to be based on the data, with the goal of making sure that we're protecting them and protecting our staff. And right now, those who we trust to provide us with the data and with the information and to help us to understand the science, well, they just haven't. They haven't been doing their jobs. And even the worst part about it is because those individuals haven't been doing their jobs, the politicians and the bureaucrats who have ulterior motives, well, they're the ones that are making these decisions for us. And we need to make sure, and we need to hold them accountable, in particular, come election time. Anyway, folks, that's going to be it for today's CRATV. We very much appreciate you all tuning in. We appreciate you liking and sharing the program, telling your friends about CRA. We are the conscience of the Republican Party. Talk to you guys again real soon.